that we know a lot about liver cancer, we wanted to spend a moment talking about screening and surveillance for liver cancer and what that means. So Dr. Taddy told you about what liver cancer is and mentioned about who's at risk for liver cancer. And the idea of a screening, or another word is a surveillance program, is that there are groups of people who are at higher risk for liver cancer, and we can identify them and then apply a test to detect liver cancer if it develops. So screening is a one-time test, whereas surveillance is a program that applies tests over a period of time. So therefore, with liver cancer, it's really a surveillance program because we're monitoring at specific intervals over time for the development of liver cancer that we know has an annual risk that I'm going to review a bit about. So the first thing I wanted to do was just a reminder about who are these increased risks for liver cancer. The first group is to think about hepatitis B. And hepatitis B, because it's a DNA virus, there is a risk of liver cancer whether or not you have scarring and cirrhosis of the liver. And so for people who have hepatitis B, we think about surveilling them differently than people who have cirrhosis. So in hepatitis B, if patients are over the age of 40 and are Asian, it's recommended in men over 40 that they undergo surveillance. And I'm going to talk about the test in a moment. And in women, Asian women over the age of 50, we recommend that they start to undergo surveillance. And there are some other subgroups within the group of hepatitis B that we could talk about as well. These are patients without cirrhosis. Patients with hepatitis B, however, can develop cirrhosis, and those patients should also be on our surveillance protocol. Another group of patients that we need to be surveying are patients with cirrhosis in general from different causes. And the most common causes of cirrhosis in this country are hepatitis C, alcohol and fatty liver disease, but there are other causes of cirrhosis that many people on the phone may have. And in those situations, we also recommend that people undergo surveillance. So let's talk about surveillance and what kind of tests we recommend. We can break these tests up into radiographic tests and into blood tests. So the radiographic test we use for surveillance in liver cancer is the ultrasound. And the thing about ultrasound is it's good, but it's not perfect. And so we want to be surveying over time to ensure that if there is a spot, a lesion, a tumor that develops, we identify it and then we move on to next steps to understand what the spot actually means. Is it cirrhosis? Is it cancer or not? The other group of tests we use is a blood test called an alpha-fetoprotein. And again, this test is good, but it's not perfect. And in fact, up to 30% of people who have liver cancer can have a normal value on this alpha-fetoprotein. And people will ask me often in the clinic, well, what about my alpha-fetoprotein level? Is this something I should be concerned about? And we use that level in addition to radiographic studies. This is what's really important, is that we use them in combination. And so sometimes the level alone, if it's low, isn't necessarily all that helpful, but we do follow the trend as well to get a sense. And so what I like to just remind people of is all that we do, and what Dr. Taddy was also talking about, is that everything is in the context of the patient and the specific clinical features. And so we use alpha-fetoprotein as part of a context and trying to understand someone's risk. So now let's move on to talking about the timing of these tests. So as I mentioned, surveillance is a program of looking for cancer over time once a high-risk group of people has been identified. And what we've learned is that surveying for liver cancer is important that we do it continually over time, and the recommendation is that it should be done every 6 months. So what that means is our patients with cirrhosis or with hepatitis B with or without cirrhosis are undergoing an ultrasound and lab test every 6 months. And that can be challenging. I know, again, everyone has their lives and they're busy and they're trying to do all the different things they're doing on a day-to-day basis, but remembering to calendar in that every 6 months, if you are at risk, to be getting your ultrasound and your alpha-fetoprotein. Oftentimes, what can happen is a spot will be found on ultrasound, and then we need to understand, well, what does this mean? Is this clinically worrisome or not? And one of the things to know about ultrasound is it's really a two-dimensional test that represents shades of gray, so black, white, and gray. And sometimes we can be unclear about what a lesion means on an ultrasound, and then we need to go up to follow-up testing, which would include either a CT scan or an MRI. And those are really the best tests to move forward with diagnosis of liver cancer once an abnormality has been determined, as Dr. Taddy was saying.